what plus this 10 plus 2?
Yes.
10 plus 2 is 12. That's a
Okay.
good number.
Okay.
Say good night.
Handsome. See you soon.
Bye.
Bye.
Okay. Bye, Dada.
Bye, Handsome. I'll see you soon. Everybody here? Well, no, Samiji. Sorry, that was my grandson.
He's very sweet.
Thank you. All right, we can get started soon. I think maybe another minute. Ready, Cyril?
Yes, we can start.
Okay, let's do it. Good. So we're gonna today talk about this is what we talked about really. It's the lung disease, asthma, and COPD, I should say, the symptoms of COPD, and the role of yoga and pranayam. So mostly this has been studied for yoga and pranayam, not so much pratyahara because it's really new in the block, but some things relate to pratyahara. Take the pranayam, it's the same actually. So we'll talk about that. All right. So, all right. So we looked at the physiology with Dhirenbhai. We looked at the pathways. He touched on some pathways that could work. So the first question is, how could we help? How could yoga, pranayam, pratyahara, how could it help? So we already have met some of his concepts before, and some of the concepts repeat themselves, which is important because it shows the power of what we're learning. It's very generic, but then we make it specific thanks to wisdom Swamiji gives us of how we can actually target things. So the first path that we know is the HPA axis. So we talked about that. That's the axis where if I see a tiger, I'm going to run. So if I see a stripe in the bushes, I'm going to run because I know a tiger could have stripes, right? So we have this system that we use to defend ourselves, but when we are sick, unwell, that system misfires. So we know that yoga and meditation relaxes that. You know, we know that that is an axis, and we went over that before, and we'll talk a little bit more about that. The second thing is the vagus. Again, the same famous vagal nerve. We heard about it even yesterday. The vagal nerve is a nerve that controls many things, particularly your parasympathetic activity, right? So it's the one that helps calm us down. Remember Ida and Pingla? So Pingla would be parasympathetic, would be the calm us down. And so we know that when you do yoga, particularly pranayam, you can increase your parasympathetic. That's one we lack. That's one we don't use a lot. That's one we should be in the evening relaxing and the light turned off and spending hours relaxed when going to bed in the ancient days. We don't do that now. We're all sympathetic. So when you do this breathing exercises, you increase your parasympathetic by up to 38%, which is a remarkable increase. And that'll catch up some of the time we've lost in the way we live now. And then in the lungs, that same system promotes dilatation. So your bronchus, which we saw yesterday, and we'll go again a little bit further in detail, the same bronchus relaxes. So we've got the HPA axis, we've got cortisol level, the cortisol level, which from the axis, remember, from our brain, from hypothalamus to pituitary, we then stimulate our adrenal glands. Again, we've been all this before and just refreshing. And the cortisol goes up. That's a marker of stress. Often the older studies use cortisol as a marker of stress. There are better measures now, but that's the traditional one. And meditation lowers that. Same HPA axis that we talked about. And finally, because we breathe efficiently, we are relaxed, our lung function is good, we build our antioxidant capacity, ability to manage oxidative stress. so that that oxidative stress is a way that damage occurs in cells. So it's a good way to help that as a core method of damaging. Okay. So this is a sort of business library. I think is a good one because it kind of explains things very nicely. So in chronic stress and inflammation, which is pretty much our baseline, we have sympathetic dominance. Okay. That's the right side, there's a hot side, the heat side. When we do a pranayam, that's the right side, the Surya Bedi side. And so we have angst and constant stress and work and exams and what have you, computers and constantly being stimulated. The HV axis increases cortisol. We talked about that. This then, in one of the way, acts in your immune cells. One of the methods it does is something called NFK beta pathway. We'll talk about it. It's important to know a little bit because that's central to how inflamed my system is. That kind of controls that. And that relieves these molecules, one or two, which we'll talk about, that increase inflammation. Now, interestingly, eosinophils are increased, which are common in asthma and allergy. And then you get these airways getting narrow, okay, which we saw yesterday. And they, over time, they get fixed narrowing and remodeled because they've been narrow for so long. So this is a chronic asthma kind of picture. When we look at yoga and meditation, what can it do? Well, we know a lot, right? The vagus nerve increases the vagal tone so that it normalizes your cortisol, right? So this thing is blocked. What it then does is inhibits this NFK beta, which is a key business thing that affects inflammation, which means your cells are less intensely active. They're also calm like you are. Your cell itself gets calm. And all the messages that an angry cell provides, which gets things going, it calms down. And what's interesting is your eosinophils also drop. And all these improve your bronchus dilatation. And because eosinophils, which are the white cells that mediate allergy, you also have less mucus production. So it actually has a really global effect on asthma, really quite spectacularly affects asthma in many beneficial ways. Okay. So if you look at those two, that's kind of the story we're working on, right? Okay. So let's look at that slightly more detail. Again, you don't have to memorize this, but it's the beauty of your body and you understand it. If somebody wants to, you can certainly write an essay on it, but the idea here is to understand how deeply this affects us and how much yoga has been shown to work. This is not just theory, it's actually been shown. So the NFK beta is a molecule that affects your DNA. It turns off and on areas of the DNA. So when it's high, it blocks our calming ones. It makes us reactive, make more and more agents to kind of defend. So it's most like we're in a war state. And so it's central to that control. And in medicine, many people are trying to make drugs to affect it, expensive drugs. Yet yoga meditation does it directly. So this is why it's so powerful. One of the reasons in our studies, we found that also the studies that we did with Samniji, we found the same thing, that yoga meditation, which we'll talk a little bit more each time. We found in our students who are volunteers at in Miami, where Samniji teach, that their NFK beta level were down-regulated, and they were actually beneficial and feeling better because of that. So it's an important thing that we've also found. In asthma, the stress which activates the sympathetic system produces more of this. And when you inhibit that, right, it switches off. And then many other messengers that make you all het up and sort of ready to go, all calm down, which are all burning energy, fuel, they're exhausting, they make you tired, and they waste nutrition. So we want to not use them unless we need to. They're your weapons we use to defend yourself from enemies, but you're using them for the wrong thing. Right. So, and these changes can be quite impressive in asthma. With yoga, you can actually changes that occur over time. So again, the same cut we showed earlier, I just put out to just remind you, and NFK beta is central to all these pathways. Okay, very interesting. And of course, the oxidants we didn't touch on, but It increases your antioxidants, which block your oxygen damage to cells. Oxygen is a fuel, right? A fuel to fire, and it can actually even cause damage when it's in the wrong place, when you're inflamed. In the right place is very good, the wrong place is damaging. All right. So that's NFK-beta. So here's some studies which looked at those, and I've got studies, I think, at the end. I think the list of studies probably not on this screen, but we'll certainly have them at the end. So as we mentioned, the cytokines, which are messengers that your white cells send to each other to have the system work and start and doing different things, are lower. So this is the reduction, okay? So it's how much reduction it is. So eosinophils reduced by almost 50%. And these drive your asthma allergy response. Okay, so let's say I'm out there, I've got hay fever, and if I'm doing a lot of pranayam, meditation, yoga, and then go out and the same amount of pollen, I'll have far less reaction. So you can imagine less mucus production, so it's much better. Again, it doesn't cure, you have to use a regular medicine. We can see how it can help as a complementary medicine approach, rather. IL-6, another very common, it's almost like a fever marker. It affects, it changes, as is TNF-alpha. They're useful when you're sick. It's just when you're not sick, then it's these weapons that cause more damage. It's almost like your military weapons and your tanks and regular roads with missiles, and the damage they'll cause to roads. That's what happens. They're necessary at the front line, but not everywhere. Right? Good. So, and then CR protein is another one that's decreased. I didn't put a plot, but that's a general marker of how my body is inflamed. It's a measure of chronic diseases. We use that. An important one here is fractional exhaled nitric oxide. So nitric oxide is a nitrogen oxygen molecule that actually is very active at levels and affects your inflammation lung and how lungs open and close. There's a very, very specific at the point of action. And it's collected like this, and it's a very simple method to collect. So if you do yoga and cognitive therapy, it reduces remarkably more than 50-55%, as opposed to just conventional therapy, we get some benefit. So here it's shown to be a dominant force. And it's directly a measure of how allergic and inflamed and reactive pathways are. So that's a very cool, and that's a study we could use. I mean, that's a method we could do. It's a very important and simple study we could set up. All right. And then other counts in your bloodstream, like leukocyte count, which are white cells, simply talked about, they're all affected. And we sort of touched on a little bit, but even other counts. So it's a much more global effect, which can help your disease. Okay. All right. Onward. Any questions so far? Please interrupt. These are obviously not necessary to memorize, but I think the strength of the data is important. And if you can, as we create this in the slides and infograms, you may be able to use some of that in your parlance when you talk to clients. All right, so then yoga, of course, the many poses. So this is one of the ones we touched on, which is very good for asthma. So what did people use? What the study show? So here I've summarized some of the studies, as I mentioned above. They're very good studies. Again, as we talked way back at the beginning, the studies I like to refer to are called randomized clinical trials, and they're studied with a control group. Many other studies you have are not, but it's okay, just as soon as you understand the quality of the data. So you can say it appropriately that this is suggested by very good observations or studies where people did and said they got better and we saw some measures, or these are studies that were done in a scientific manner where they had a population with control and they can show the benefit. In the controlled ones, they're different quality studies. It's not the best because we didn't have hundreds of patients, but or subjects, but overall, when you add them together, the effects are very convincing. So they use different yogas, asanas, meditation, different methods to assess a study, and some use just mindfulness, all right, and showed some benefit in quality of life. Others use pranayam breathing, and the ones with pranayam show more of the lung function. So when I talk about lung function, the peak expiratory flow, or PFT, what that is you have like a little device, a little bit like I showed you there, and you blow, and it measures your peak, right, when you're doing your fast buzzing. You can imagine with pranayam how good that would become, as Samaji told you and I told you. So that's an obvious benefit. And then it also tells us if I empty my lungs, how much my capacity is. So all those functions, right, improve when you have pranayam. While the mindfulness works and you feel better and less stress, you don't see the same benefits as you do when you do pranayam. So you can see that pranayam is adding to what mindfulness does. So again, yoga breathing technique, they found same, the pulmonary function getting better, right? Asthma control symptoms, asthma control is getting better. Good measures. Anum Vilom, Kapalbhati, Primary, and Surya Namaskar in this study by Gupta et al. Again, these got better consistently. Kapalbhati postures, some of the we'll talk about. Another study, mindfulness, which shows some improvement in lung function, but they had some stretching exercise with it. So it looks like the physical as well as the mindfulness to get the benefits. All right, so quite a few studies. So there's no lack of data. And many, in fact, virtually all the studies do exactly what we're teaching you. Similar, very, very similar things, which we'll go over tomorrow. All right, lots of good studies. And you can vary from stamps. So overview then, again, people like plots. So I created this one. So the FE1, which is a forced expiratory volume. So that's kind of you force it, right? Then this is a functional viscous capacity, which is how much function my lungs are. Lung has a lot of space, not all you can use, and there's a functional space you could use. Other space is extra, but the functional space, it tells you that, and it's improving. So everything on the left favors yoga, and everything, if control was better, like standard therapy, we'll put on that side. Peak flow, which I demonstrated, and my quality of life, so my daily living value system, how I'm doing things, activity, it's definitely better. So these are all from data that I presented, or summary data. It's like those studies put together in a meta-analysis where good studies are put together, and you get a bigger sample size, okay? So again, very, very convincing. And then lung function, right? So again, this is another way to show it in some magnitude. So you like the magnitude. So your force factor, it moved up that much, right? And so you can see the magnitude effect. So that kind of worked the most, which is this is what we use breathe. This is what we basically use when we're breathing, right? Or when I'm going fast. Vital capacity improves, which is my net ability to increase if I want to. Peak is my strength, which increases how fast, quickly I can eject it and cause life. So again, quite dramatic benefits. Okay. Any questions? Just let me know. So what are the asanas? We've touched on briefly, and I'll put them together here. We want ones that cause chest expansion. We talked a little bit yesterday. And then ones that improve circulation to lungs. Okay. So that's the general basis. So Setu Bandhasan, right? Makes sense. We talked yesterday, Bhujangasana would definitely make sense to expand, right? Majrasan, which is cat-cow, Vithalasana, which relates to that. Fish pose, we'll talk about later. And of course, the seated spinal twist. It stretches your rib cage muscles, intercostal muscles, so you can see that work. So these are the ones mostly used in studies in different combination. The odd one studied one thing other more. And then breathing techniques, again, the Nadi Shodhan, which makes sense, which is stress, stabilize the autonomic nervous system. That and Anum Vilom both, it's at the bottom. Kapalbhati, which is makes sense, right? Cleanse the airways, forced exhalation, rapid. You can imagine how strong your diaphragm gets. And Brahmari works, calming and improves respiratory efficiency. And in Brahmari, because I'm doing that peep. Remember, Dr. Everybody mentioned that you're opening your lungs and allowing things to sort of work better when you do this first breathing off. And so Brahmari does that. So you can see what you learned exactly fits in what works, and that makes sense. It's quite nice. Everything ties up very nicely. Theory, practice, and then data all support that. And the wisdom, ancient wisdom, all things are aligned. Good. So in a similar vein, we talk about the COPD. Now, COPD, remember, is the condition that is inflamed airways, mucus buildup, narrowed airways, And this is a chronic scarring, right? From smoking, pollution, from living in cities too long, fumes, traffic, even close to railways where they have micro particles. These all things can damage your lungs over time slowly and get to this. And it's a very common condition. And you see many people walking around as they get older with oxygen, lean toward backwards, lean forward. They're just to characterize pose that they have. Again, in that, quite a few studies showed improvement. Again, pranayam asana showed 45 minutes a day for 2 months. Again, I didn't quite emphasize the duration, but usually they're about 30 to 1 hour a day, and they last 2 to 3 months to see those benefits. Here's 45 minutes a day for 2 months. And again, the same measures improved. Another study, 30 minutes 6 times a week for 3 months. Muscle strength improved. Another study, these are all over the world, not just in the USA or UK or India, but many parts. Gentle asanas and pranayam improved functional status. And Rasam 2019, again, 8 weeks, they showed improvement in quality of life. Okay, and they have this measure of 6-minute walk distance, so how much you can walk 6 minutes, and that's a simple way to measure how well they are, and that improved. So very simple tools that you can show benefit within a few months. All right. The data here is from some of the studies. So lung function, again, the forced expiratory volume when I'm forcing out and what the volume is. So when I'm measuring the volume, and then when I'm measuring how my peak strength is. Are two related measures. This one's about I'm quickly filling the balloon up within a minute. How much can I do? And force factor is what how much I have available that I could use, and it increases a fair amount. So this is increase. It's about about 123 milliliters, which is significant improvement in a few months, right? And then my excess capacity, we just talked about, the 6-minute walk distance is a measure, and it improved by about almost 40 meters. So the 6 minutes, I could walk a distance, let's say of 20, 30, 40 meters, I can double that in 6 minutes by 3 months in those people with the lung disease we mentioned, COPD, probably on oxygen, you can improve that much and strengthen oxygen, right? And then, as again, I mentioned, the stress anxiety, right? Because when you're sick, ill, asthma, when you have chronic disease, you can't breathe and you get exhausted very quickly. All the cortisols will go up. Stress anxiety is common, and they found a 50% reduction in mental health, improvement in mental health, right? Those stress. So quite dominating data, right? Quite convincing. So what do they use? So again, the concept here is asthma. They're usually quite healthy in a sense. So you can use the harder poses and breathing. In COPD, they're often quite sick or have to sit, rest, can't walk very far. So there we do the opposite. We do energy conserving type techniques. So there's some overlap, and mild ones can do both, but the principle here is to do energy conserving type. Here you do the more normal type. So pursed deep breathing, which is close to Shitali and Shitkari, which probably would work, is one, because again, like Brahmari, that's the same thing. What I'm doing is I'm actually opening my lungs up. I'm stenting them by resistance. I think by resistance. If I'm blowing a closed area, then I'll make my lungs open up. It's like when you hold your breath. Sometimes when you fill your lungs up and you hold your breath, it's almost doing that. So that helps, and many studies used pursed deep breathing. Nadi Shodhan, of course, will work. Nadi Sudhana Shodhan, Pranayam, also not true, because you're kind of, and sometimes in Nadi Sudhan, there's a version where you even hold it. So that would work. And again, Brahmari, we talked about the deep breath, Mahapran. Okay, so you kind of do more restorative and energy conserving methods. And likewise, the asanas are modified, right? So you would use chair yoga, because many times they will not be able to yoga properly. But even chair yoga will get them to a good place. And we've done some of the chair yoga. If you remember, the seated mountain, which helps spinal decompression and encourages diaphragm breathing. There's a seated forward bend. We do lumbar stretching, improves flexibility without fall risk. Seated twist, right? Thoracic mobility, which helps your rib cage expand and strengthens the muscles that control that. Seated side stretch, intercostal muscle release, right? Very, very important. Seated cat-cow, you can do the same, multi-segmental. Seated marching, so your flexors and legs. And then seated savasana or a seated form of kitesurf would lower your heart rate, as we know, calm you down and get you in a very good state. You can do it at the end, perhaps. So standing mountain also, which can help correct forward slumping, is often up bent, or like I'm talking to, often they're bent over because they have no choice. And then supported chest openers. And you can actually use the chest. Remember we did that, and we had to have to put arms behind the chest like that and open a chest. So those techniques can work really well based on the ability. So, and that opens rib cage and without straining the muscles, supported. Okay. So what are the comparisons? Well, it's good to put them side by side, and this is probably a good summary slide. So for yoga, which is for asthma, mild and moderate, severe you can do, but severe asthma is almost like your COPD because they're pretty breathless and they can't do a lot. So you could probably do the COPD version with the severe asthma, the ones who are on oxygen perhaps, or can't walk very far because asthma is so severe. I think you could shift on to the COPD side. It just sort of makes sense. For yoga, then the primary goal is open chest cavity, reduce stress, induce bronchoconstriction, right? The spasm, the wheezing sound that we talked about. Whereas for COPD, it's increase your exercise capacity. It's I want to walk further. I want to do more. So you're focusing more on that. And of course, the strength. You don't have bronchoconstriction, though does medicine help, but you basically have strength. So you can work with your scarred lungs. So you can make them work better. The key asanas are like the Setu Bandhasan, right? Of course, we talk about the seated twist, cobra, cat cow. Surya Namaskar will work also for all the reasons that we know. Whereas for these are modified gentle poses like chair yoga, standing, mountain, and supported chest openers. Breathing, again, it's deep cleansing, Kapalbhati, Anulom Vilom, Brahmari. Here's more controlled resistance. You're pursing lips, you're using Shitali or Shitkari, maybe, and of course, Brahmari and Nadi Shodhan. So you're trying to stent the lungs, like. Meditation type, again, in asthma, you focus on reducing anxiety triggers. Remember that anxiety can trigger asthma that we heard last couple of days, and your panic response. So when you're in asthma, also, you're more relaxed. And if I'm asthmatic and I'm air hungry and I'm breathing, I'm wheezing and I'm waiting for oxygen and not feeling good, my anxiety makes it worse. It'll make my vessels even more tighter. So I want to be able to relax so that I don't make it worse. If you're anything, I like relax. So it's very important. Very important. Particularly in children, very important. They panic. As you can imagine, air hunger, you panic. And then for COPD, there's focus on energy conservation and managing chronic breathlessness. So it's slightly different focus, and that's why the poses are different and the meditation type is different. Outcomes, again, both improve. In the yoga, we do my lung function and ability and speed and capacity improves, which is what I want. And in COPD, I'm not going to get my lungs back to normal, but expand what I can. I can walk further, and that's kind of the 6-minute walk distance is a good marker for that. And then my volume, spare volume I have when I'm forcing my breath out. Physical impact, of course, improves quality of life. And even in COPD, it's increased quality of life, depression drops from the disease, a chronic disease. A little different, it's not so much anxiety as depression. Those anxieties, that bad, but here's the anxious, can't breathe kind of anxiety, though they both have an overlap clearly. All right, then most programs are about 2-3 months and 30-60 minutes, mostly 5 times a day, 5 times a week, maybe 6 times a week. And generally they do well. So You won't be exhausted if you use a simple one. All right, good. So that's it. Any questions? This is time to ask.
Hello, Devendra Bhai, Jai Jain. Excellent presentation, very well explained. Just on the last part of it, asthma versus COPD. So with I'm trying to understand the asthma factor a little bit more. With asthma, I understand that it's, a person could be normal, but something that would trigger asthma, then the condition worsens, right?
Right.
With COPD is constant. The patient is suffering. It's a chronic condition, right? So the yoga asanas that we are prescribing for asthma, it doesn't change for COPD. COPD, we know the condition is constantly existing, and anytime we know that a person has COPD, we know how to be careful with them. But with asthma, if a person is under normal condition, we can prescribe what was listed on that slide, the Setu Bandhasan and the other asanas to open the chest, make breathing more efficient. But when they are suffering from an asthma attack, is it recommended at that time, or what precautions should we take?
Yeah, so you make good points. So just so high level, the context, I think COPD chronic damage happened many years ago, so you can't reverse. Though, having said that, I think some of these are detoxifying to some extent, so I wouldn't take away some benefit, some reversal, even COPD. I think I wouldn't say it's not, because there's somebody teaches that some of these things are removing toxins, and I think I know what that means, is removing some of the scarring. So, but on the whole, yes, it's been happening over years, and by the time you get it, it's too late. You've kind of already had the damage. And they try to improve what they can do rather than normalize. Correct. In asthma, yes, you're absolutely right. You have to talk about it at two different levels. One level is preventive, right, which is the one we want to teach and exercise and get good, and that's same as you and I would do, but maybe more so what's specifically good for them. We say, for you, this is what, spend your time on this. If you have this much time, do this. If you have this time, do what you want. So we're trying to package, right? So yes, you would give them these, because no point in them doing something for migraine, it's not going to help them. So that's kind of the main purpose. But yes, in attack, interestingly, what happens is, let's say if you are already doing yoga, you can actually tell them to use the diaphragm more, because there's more lung there to be recruited. So I think that if they already learned yoga to a point to understand what you're telling them, if you ask them to calm and take abdominal breathing, they'll feel better, because there's lung tissue there that they've not used. So yes, you can improve them in attack, right? And the other thing in doing attack is, look, let's try and relax, right? You know that they know how to relax, right? So you can, to the anxiety piece. So I think you can help pieces with regular medicine. And what will happen is they're more likely to do regular medicine well. If I'm a little bit calm and take deeper breath, the medicine that's going to help the lungs, I'm going to take in deeper, right? So I see tea as a marriage. I think you can make a huge impact. Quite a lot of times in asthma, you're in such panic, right? I mean, obviously kids particularly, but adults, you get in such panic that you're beside yourself, right? So if they already had some knowledge of yoga, meditation, and calming techniques, you could start working on them. So I do think that there's a role. I think the important thing is to train them really well when they're well, so that they can use that tool when they're sick. Does that help?
Yes, it does. Yeah, perfectly.
Good. I'm surprised nobody in the group has asthma. It's so common, You expect somebody to have asthma. Well, I think I know somebody who has asthma. Good. If no other questions, send me anytime, set questions, and we can.
Yes, thank you, Dr. Devendra. You have given really very
excellent presentation you have always been giving like this, and it is having full all the medical reasons and all the precautions you are also suggesting, and at the same time you are also referring yoga practices how they can help in this particular problem. So that is really very good and very positive way of presenting things, even from the doctor side or medical side. And it will also help all people to understand why doctors themselves are referring to these yogic practices to get rid of all these health issues. So yes, asthma is a very common, as because it may be because of pollution, is it not? Or it is only due to some blockages or some what we say cold problem. But due to pollution, it happens that people get asthma.
I think pollution can make it worse, but the current theory, which is interesting, is that we live in a very clean, overly clean environment, in areas, and then there, for some reason, we look for a problem, so we don't see one. So I think there's a feeling that in a very sterile environment, you develop asthma more. So there's studies, if you're brought up in the farm and raised in a farm, and your brother or sister is brought up in a city, then the one in the city gets asthma, the one in the farm doesn't get it so much. And then if you take some of the bedding from the farmhouse to the person in the city, then they don't seem to get asthma. There's something about our body getting no challenge because everything's so sterile. It seems that asthma is in the rise. So even if you go in India, the cities is in the rise, but in the villages, it's like it used to be. So there is something about city life, not just pollution, that's one of them, but also this environment and how clean and sterile. So our body needs some chronic illnesses and around to keep us fighting it, keeps it busy, otherwise it looks for problems. So anyway, it's a very interesting theory, but that seems to be how it's working out. But pollution definitely is lethal. It'll make it worse. You want to move out of pollution, you want to move away from smoking, you want to stay away from people smoking. And sometimes you have to move, people with asthma have moved to Florida because it's much easier to live here.
Yeah, it may have to do with the lifestyle also, because the city lifestyle is much more sedentary compared to a rural or village lifestyle. And also the type of pollution is different. In the cities, it's much more smoke from automobiles and burning and other things, where in villages or rural areas, it's more dust related perhaps, or I don't know, I'm just theorizing.
No, I think you're right, and you're right. And sometimes in the tropics it can be worse because you have more allergens, less. Sometimes in temperate climates you get less allergens, just seasonal sometimes. So it can. The problem is there's so many factors, it can go both ways. If we go to Uganda, the asthma is on the rise there. Nobody knows why. It's like really high, and they think it's because the pollen is so high. So the problem with lung is, it's got so many factors that affect it, that everywhere I turn, then I see a different problem. So I was surprised to hear about that, but that when I went to Uganda, it's actually very common there, more common than expected. We're probably in the village less polluted in a sense, they're not much urbanized as we are, but then the more natural food, they're more, plants grown in the ground, but the pollen is very high. And so it's hard to know. But farming sometimes plants different cash crops, and maybe that's why they're not used to them. So give me lots of factors. But to your point, yes, what we're breathing in is triggering it, and that could be many things. Pollution definitely is bad. If you live near a rail line, then you definitely get worse. Even in the same city, in the same village, which is healthy if you go, because the micro. So no question, that's a big one. As somebody says.
When we had coal engines.
Yes.
Burning engines.
Even now, yes. Even without them, I think they have microparticles. I think that seem to be emanating. So Yeah, I think plastics, we think the story
Asthm.
that these microplastics may be proven, not proven, but there's suspicion that's embedded in the lungs that may be provoking problems. So many things are making it worse, but it's on the rise. Asthma is on the rise, more common,
Yeah, unfortunately.
unfortunately. Yeah.
I did have a quick question, and I apologize if this has already been asked and answered, but the research was kind of talking about asthma as a whole. Does it make a difference for those articles or in how we think of yoga as treating asthma, if depending on what type of asthma it is, meaning if it's like exercise induced or cold induced or like the eosinophilic asthma or anything like that? Or
Yeah.
overall, is it generic enough that the research applies to all of those cases?
I think you're very good question. The generic applies to all, but in some studies it breaks it down, and it
Okay.
seems to benefit some differences. To your point, what was surprising is that it even helps the eosinophilic asthma, for which I wasn't quite aware of until I read it, because it does tone down eosinophils, which is something that I wasn't aware of. So it seems like it's a global benefit. It does have to be done for that period of time. I think the answer is not short term. You have to continue, and I think but I think it across board. As we just discussed, if you live in a city with low pollution, probably can help so much. So probably you have to make other lifestyle changes. This is one strategy, right? You cannot fix. I can't live in a bad city because I do asthma yoga. It's not going to work. so so I think we have to combine it, and we're teaching complement. We're not competing with medicine, lifestyle. We're complementary, right? In diet. In that sense, I think it'll help in most settings.
Okay.
Good question. And some of the papers have data, so if I find some, I'll send it to you. You can look at it in detail. It's a good question.
Thank you.
Geographical conditions are also the cause of asthma, is it? Wherever there is the rain, much rain or cold. So in that condition, also people get such kind of problems without having any internal problem.
Yeah, and if you're in a humid area, then you get mold. Mold is
Mhm.
a con. So your problem in humid areas, it's very hard to avoid mold in a bathroom. And so if you go most places in humid places, unless they're they have a cleaner every day, they're very, very careful to keep it dry, almost always you find mold. So people's asthma, mold is a big trigger of asthma. It's one of the major triggers. So in humid areas, usually the mold. Generally, if I have asthma, humidity might bother me. Depends on my lungs because I have slightly thicker air. It can bother me. And then cold, anyway, your sympathetic system fires when you're cold, so it narrows. So cold will make my airway narrow temporarily. And if I have asthma, it'll make my asthma worse. So cold is a trigger. And then the moment my airway get narrow, then I cough, and then suddenly the cycle starts up, and I start getting more wheezing. So cold is a trigger. It's not, I wouldn't say cause, it's a trigger. It doesn't cause it's being cold. I have asthma, it'll make me have an event, but not the primary cause. No. But mold is, which is more in the hot climates. That's why I say sometimes where you live doesn't help you. Humid areas, you think weather's warmer, but it may not help you. It's a lot of mold. It can, so, my son, he was rowing, and every time he went to practice, he would get sick. And we realized he was practicing in the barn, there was mold. Until we figured out, we didn't know. Mold is a very bad one, and it's usually in hot, damp areas, not well cleaned. In houses not cleaned properly, you'll see that particularly in bathroom areas, kitchen areas, wet areas, and that mold is hard to find, very common trigger. So good asthma teaching will go through all of that. The carpets are very bad for asthma, so you have to get rid of carpets. Have dry wood floors. Carpets carry a lot of triggers to asthma. You have filters so that your pollen doesn't come in the house. So, because I wanted asthma in our family, we had to do all of that. And so we have hardwood floors. So we all be together, and then they're happy. Then they're completely fine. But if I didn't do that, they'll be wheezing and medicines throughout the year. So you have to think through everything. So whole protocol like that. You have to do all of that, and yoga can be one of the tools to help.
Yes. Anybody has any question? So thank you, Dr. Devendra, for taking so many sessions, giving so much good informations from medical side, and also incorporating all yogic practices with medical science. So it is good that we are getting very good, what we say, combination, and we can say that we are blending science and yoga together, medical science and yoga. So thank you. And now nobody has any question, is it? So
No, I must say
now
that
Rakesh Jain
the
is
data.
ready.
Yeah,
Yeah.
no, I was just
Yes.
going to say that the data that Dr. Devendra presented was very convincing. It really, if we talk about the benefits of yoga to people with asthma or COPD, and we show these scientific studies behind them, it's much more convincing to them, and they're much more willing to probably practice yoga.
Yes.
So it was excellent, just great.
Thank you.
So now Rakesh Jain will give the session of
Yes,
today.
yes, Samij.
So 2 days, at least everybody has to give some session, but try to cover all the instructions which have been given, especially for particular practice which you are taking for particular session.
I was going to practice contemplation today. In the past, I have done Kyotsurg and perception of breathing. So I thought I'll do something different this time and try to attempt contemplation of fearlessness today.
Yes.
So to start the meditation, we'll choose a comfortable posture. Could be Vajrasan or Sukhasana. The important thing is if we are sitting, it could be done sitting or standing or lying down, but if we are sitting, make sure that our spine, neck, and head are in a straight line. And the position of our hands could be in Gyan Mudra, with the index finger and tip of the thumb joined together, and the other fingers being straight, and the palms facing upward, placed on our knees. And then we'll softly close our eyes and recite Om Mantra 5 times. Take a deep breath and chant Om, Om. Next, we will relax our body. Kayotsarg. Kayotsarg is the exercise of complete relaxation with full awareness. Keep our body absolutely still, no movement at all. Then we will visualize each part of our body and suggest it to relax one by one. We will start with the big toe on the right foot. Focus your attention on the big toe of the right foot. And suggest it to relax. And now we will move our attention to the other toes of the right foot and suggest them to relax. Similarly, the sole of the foot and the upper part of the foot, the heel, ankle, and the calf muscles, the knee, thigh muscles, and the hip joint. Suggest each muscle to relax. And now we will move to the left leg. Again, starting with the big toe. Focus all your attention to the big toe and suggest it to relax. And then the other toes. The sole of the foot, the upper part of the foot, the heel, ankle, the lower calf muscles, the knee, thigh muscles, and the hip joint. Suggest each muscle to relax. Feel that both legs are now fully relaxed. We move on to the middle part of the body, the lower abdomen. Visualize the abdominal muscles and all the internal organs. The stomach, the intestine, kidneys, liver, spleen, Suggest all of these muscles to relax and the organs to relax. Moving on to the chest area. Suggest that all the chest muscles be relaxed. The heart and the lungs, suggest them to relax. And the shoulders, the back muscles, and the right arm, starting with the thumb and the fingers, the palm area, wrist, lower arm muscles, elbow, and the upper arm muscles. Suggest each of them to relax. Similarly, the left arm, starting from the thumb, all the fingers, palm area, wrist, lower arm muscles, elbow, upper arm muscles. Suggest each of these to relax. Now the neck area, neck muscles, and the facial muscles, and the head muscles. We'll relax our throat, the seat of our voice. Feel that the whole body is now fully relaxed. Now we'll move on to the contemplation stage. Focus your attention on the entire chest region. The chest area below the neck. And focus on green color. And repeat with me that my positive attitude of fearlessness is becoming stronger. I am becoming free from fear. We'll repeat this aloud 9 times. My positive attitude of fearlessness is becoming stronger. I am becoming free from fear. My positive attitude of fearlessness is becoming stronger. I am becoming free from fear. My positive attitude of fearlessness is becoming stronger. I am becoming free from fear. My positive attitude of fearlessness is becoming stronger. I am becoming free from fear. My positive attitude of fearlessness is becoming stronger. I am becoming free from fear. My positive attitude of fearlessness is becoming stronger. I am becoming free from fear. My positive attitude of fearlessness is becoming stronger. I am becoming free from fear. My positive attitude of fearlessness is becoming stronger. I am becoming free from fear. Repeat this another 9 times silently to reinforce it into our subconscious consciousness. Imagine that these words are written in green color across your chest. And read them slowly, word by word. Now focus your attention, the center of bliss, the heart region, and feel that the bright green light is emanating from the center of bliss, Ananda Kendra. and feel that my positive attitude of fearlessness has become stronger, and I have become free from fear. Repeat this several times silently. I have become free from fear. My positive attitude of fearlessness has become stronger, and I have become free from fear. One more time. I realize that my positive attitude of fearlessness has become stronger, and I have become free from fear. With this, we'll conclude our meditation with the recitation of Om 2 times. Take a deep breath. Om. Rub your palms together. Place them over your eyes. Blink your eyes a few times. And slowly remove your hands and open your eyes. This concludes today's session of meditation. Nami Naman Sami Samji.
So thank you very much. It was very good session, and you have covered the main things of the contemplative technique. So it was good. You have to repeat the same tomorrow also, so that it would be clear in your mind.
Yes, Samiji. I forgot the resolution, to make the resolution that I am practicing Preksha meditation. So I'll remember to do that tomorrow.
Okay. So yes. So just all the steps have been given, 1 to 10. There are last two. They are also, they can also be included
Okay.
in a session. And if time is short, then we can skip.
So the
But-
last two were Abhay.
That is fearlessness. So I am fearlessness, fearlessness, fearlessness. In this way, 3 times it is repeated.
Mhm.
So the last 2 steps are not very much necessary in my view also. You have done very good that you have shortened and there is a very concise and precise way of giving session, which you have done. So it was good.
Okay.
Just the 9 times the affirmations, and we have to repeat aloud and mentally, and 3 times on the chest we have to see the same affirmation and accept that now I have adopted this quality in me. So that is also very important to cover. And every other thing is good.
Thank you so much.
So thank you. And in those who will give other contemplations, so there is a short indications that every other steps are common, and just you have to replace the particular word. So whatever contemplation we are giving, just we have to replace that particular contemplation and the particular word for the particular contemplation. Everything other we have to follow the same. The method is the same for all. Okay, so it is good. So tomorrow is a session of this week, and after there are 2 days holidays. Okay. So thank you.
Vandami Naman Sami.
Samji, Rakesh, that was awesome. Thank you so much.
Thank you.
Gives us confidence. Gives us confidence that we can do it one day.
Just learning by watching something.
Thank you, thank you, thank you, thank you, thank you. So all are ready for game. So thank you. Now we are doing.